Good morning, friends. Today we will learn about another virus, that is the poliovirus, which causes an important disease, that is the poliomyelitis. So we will learn about this disease, what are the symptoms for this disease, what are the peculiarities of this virus. So let's start. So let's start with the case presentation, how the child affected with this poliovirus, how this child will be presented. A 10-week-old baby brought to emergency room with weakness in his left leg. On examination, there was flaccid paralysis in the limb. No deep tendon reflexes can be elicited. Sensory sensation was intact. The tone, movement, and reflexes of other limb was normal. On checking immunization record, it was up to date. On series of examination, there was elevated protein with normal glucose level. When fecal sample was collected, sent to the reference, it came out to be a vaccine strain. So the clue in this question left that one is the flaccid paralysis, another limb is normal. Sensory sensation of the affected limb is intact. This is very important. Sensory sensation intact. Deep tendon reflexes cannot be. So it is a case of acute flaccid paralysis in which only one limb is affected, another limb is not affected. When we check for the immunization record, so immunization has been taken by the child. On series of examination, elevated protein with normal, so it is going in the favor of aseptic meningitis, because in case of aseptic meningitis is caused by the virus and there is elevated protein but the glucose level is normal. So when they have sent the fecal sample, it came out to be a vaccine strain. So that is going in the favor of poliovirus, in which we see it presents with the acute flaccid paralysis, and there can be asymmetric presentation between the limbs, like one limb is affected, one limb is not affected. And also the paralysis which affects the limb, it also is in decreasing manner, decreasing fashion. Now we come to the poliomyelitis. So this poliovirus, it causes a highly infectious childhood disease. It causes acute flaccid paralysis. There is an involvement of nervous system. So this poliovirus infection come in the central nervous system because it affects it. So and as we know, in our country it has been eliminated. Polio is in the verge of eradication globally. So initially we used to learn that pain, that is the Pakistan, Afghanistan, India and Nepal, that is PAIN. So they all were having the high cases of poliomyelitis, but now India has been removed from this list. There has no case been detected and it has been eradicated from the India. So what is the structure of the poliovirus? That is, this virus is simple in structure, very small, non-enveloped. It is spherical in shape, have icosahedral symmetry, and it has a single-stranded RNA, which is positive sense. So this you can see the poliovirus. There is the structure of this poliovirus in which you can see the RNA is there, viral capsid. Then there is a shell, membrane, glycoprotein. Now, what are the different antigenic types of this virus? So, we use two terms. One is a wild poliovirus, another is a vaccine-derived poliovirus. Wild poliovirus means the virus which naturally cause the disease. So, these are the three strains which were circulating in all over the world. That were the wild poliovirus strain. That were the strain 1, 2 and 3. Type 1, type 2, type 3. We used to say like this. And these three strains, they are genetically and immunologically distinct, although clinically manifestation of all the three strains are same. But if we see on the level of genetics or the level of immunological, that is being different, and they differ from each other in the VP1 region. Now, what is this vaccine derived? Because we use live strain when we vaccinate the child, that is a OPV, oral polio vaccine. So that is a live strain which has been attenuated. Attenuated means that the strain has been weakened, but in less than 1 per 1 lakh of the child who had been immunized with the oral polio vaccine, they can get the infection from the vaccine only, and that is known as the vaccine-derived poliovirus. So that can sometimes be neurovirulent. So the antibody response, that is type specific, that means if a person is being affected from type 1 poliovirus, so antibody will be formed against that only, and these antibody will not be protective against the type 2 or type 3 strain. Currently over the this in the whole world, only the natural cases which are coming, they are caused by only one strain, that is the type 1 strain. Type 2 and type 3 has been eradicated in 1999 and 2019 respectively. The last case which has been reported from our country, that is 2011 January, and once when no more case come, that is for 3 years, then that country can be declared free from or eradicated from that disease. So India got that certificate in 2014. Now what's the pathogenesis for this disease? That is, the main route for getting this infection is fecal-oral route, and rarely by the respiratory droplet, inhalation or the conjunctival contact. So main what you have to learn, that is the fecal-oral route. Now, once the virus enters the GI tract, it reaches to the intestinal epithelial cell. From there, it moves to the lymphoid tissue in the submucosal region, that is lymphoid tissue of tonsil, pairs, patches. So they all are there, and there the virus will multiply. So then it binds to the receptor, that is CD155 receptor, which are present on the cell surface. Now from there it will move to the CNS, that is the central nervous system. So it reaches to the spinal cord, from there it reaches to the CNS. Now there are two routes. One is the hematogenous, that is through the blood, and another is through the neural route, that is through the nerves. Now hematogenous route is more common. How this virus reaches to the central nervous system? That is, once virus spread to the regional lymph nodes, like I have told you, it enters to the GI tract, intestinal epithelial cell, it reaches to the submucosal region where there are lots of lymphoid tissues there. So once it reaches to the lymph nodes, it will spill to the bloodstream. So this is the first primary viremia. Viremia means when the virus comes in the blood. At that time, the first stage of fever comes to the child. Now, then it reaches from blood. Now this virus will go to the reticuloendothelial system. Now what is this reticuloendothelial system? That is, it consists of your spleen, lymph node and your liver. So they all are reticuloendothelial system. So there it reaches, multiply, and again it enters the bloodstream. So first it comes to blood, then RES system, then again to blood. So this is the stage when the second time the fever comes, and it causes the secondary viremia. It is carried to the spinal cord and to the brain. Now, neural spread, although it's not common, but in case of the tonsillectomy, like if a person, if a child has got the viral infection of this poliovirus, and at that time only, if the tonsillectomy has been done due to some problem in the tonsils, so through the virus may spread via the glossopharyngeal nerve, which is present in the tonsillar fossa. So that can be a neural spread, which is very fast. So what is being affected in the poliovirus, that is the anterior horn cell of the spinal cord, which will lead to the muscle weakness and the flaccid paralysis. So mainly the anterior horn cell of the spinal cord are being affected, and that led to the weakness. Neuron degeneration occurs, that is the earliest change in the neuron, the degeneration of the nasal body. What is this degeneration? That is, you will find aggregated ribosomes. So pathological changes which they are more extensive than compared to the paralysis which we clearly see in the child, but pathological changes are more extensive as compared to the physical changes. Now, what are the how the patient of polio, how the patient will be manifested? Incubation period is 7 to 14 days of getting the infection. Manifestation, so can be different manifestation. One is the inapparent infection, that means the child is totally asymptomatic. So there is no fever, no paralysis, so they are 91 to 96%, they are asymptomatic. You will not notice any change. Then abortive infection, that is fever, malaise, sore throat, anorexia, myalgia and headache. Then so they are approximate 5%. So you will notice viral changes, usually when we have viral infection, so we have this manifestation, sore throat or with the fever. Then non-paralytic poliomyelitis, that is the 1% of the cases, they show aseptic meningitis. That means aseptic means a feature of viral meningitis. Meningitis means you will have the neck rigidity. So only 1% will show cases of aseptic meningitis where you will have the feature of meningitis. Now less than 1% of the total public who is being affected by the virus, only less than 1% will have this paralytic poliomyelitis, and it is the least common form. So how paralytic poliomyelitis person will have features, that is the descending. It is a asymmetric acute flaccid. Usually there are many etiologies under the acute flaccid paralysis. It's not only that polio causes the paralysis, there are so many diseases in which we notice the paralysis. Now it is a type of a flaccid paralysis. So that is the term flaccid, and the muscle tone is being lost. So this is type of a flaccid paralysis. It is acute presentation. That is suddenly there will be a paralysis, flaccid and descending. That means whichever limb is affected, the upper part of the limb is more affected as compared to the, so this feature is very few in only few etiologies. So that is how we can differentiate from the different etiologies of the acute flaccid paralysis. So it is descending, asymmetric, that means some part is affected, one limb is affected, other is not affected. So this is how asymmetric presentation is there. Proximal muscles are affected earlier than the distal. So first the proximal muscle are affected, then the distal muscle will be affected, and in finally how the child will present, that is the residual paralysis. That means whatever is being left, some part will be healed, some part will be left. So the left part will have the paralysis. Paralysis starts at hip, proceed to our extremities. So typhoid sign, that is a very important MCQ. This sign is being seen in polio, that is a typhoid sign. Child sit with the flexed hip, both arms are extended towards the back for the support. Then comes, site of involvement can be different. It can be spinal, it can be bulbospinal, it can be bulbar. So there can be different involvement of different sites. Biphasic course, I have already told you that in children aseptic meningitis occurs first, recovery, then return of fever. Like when I have told you primary viremia, so that is the time where aseptic meningitis, that is the first time the fever comes, then recovery, then return of fever with paralytic features 1 to 2 days later. Cranial and nerve involvement seen, but there is no sensory loss. So sensory loss is not there. When you will touch that limb, the child will feel that you have touched. That is a sensory sensation. Cranial nerve involvement can be there. So this you can see the pics of the deformity in the poliomyelitis, how the limbs have been affected. It can be lower limb, it can also be the upper limb. What is the risk? Like I have told you that in clinical presence, only less than 1% have the risk of getting paralytic poliomyelitis. So there are certain risk factors which will predispose to this condition. That means converting non-paralytic poliomyelitis to paralytic poliomyelitis. So risk factor are older children and adults. If the adults are getting the infection or the older children are getting the poliovirus infection, there is a more risk for paralysis. Then pregnant women, heavy muscular exercise. When the person is having this poliovirus infection, and at that time if he is doing this heavy muscular exercises, so at that time can be converted to a paralytic poliomyelitis. person undergoing trauma at the time of CNS symptoms. So when this feature of aseptic meningitis are coming, if he is under trauma, under stressful condition, so that can also be converted to paralytic poliomyelitis. Tonsillectomy, as I have given you the in the previous slide, and IM injection. This is very important. If you have given intramuscular injection at the time of fever in the involved limb, so in the limb in which you have given the intramuscular injection, there will be very increased risk of paralysis in that limb. So this is very important because like in many places quacks are giving the treatments. So like a child reaches to these quacks with the fever, and this fever is due to this poliovirus, and if they have given any injection at that time, so it can be converted to very high chance of conversion of to paralytic poliomyelitis. Therefore, it is being said not to give injections. Even vaccinations are not being given if the child is having fever. Immunization is being not given. So this is very important to remember. Don't give any injections. Don't do these. This like tonsillectomy, or whenever we go for any surgery, we look whether the condition of the child is good or not. Only then these surgeries are being carried out. So in fever, usually we don't go even for the immunization also. So that is the important point why we avoid the immunization when the child is having any fever or any other viral symptoms. Now, how you can diagnose the case of poliomyelitis? So usually we can have different type of samples, but one is the throat swab, which you can take for 3 weeks of the illness. After that, it will not come positive. So stool sample can be taken up to 12 weeks, or the rectal swab. So for that we have to make like for immunization, like when we do immunization with the vaccine, for vaccine we maintain a proper temperature that is being called as cold chain. But when we maintain that temperature, that is this 4 degrees centigrade, for the stool sample to be transported to the lab, it is being called as a reverse cold chain. Now the virus isolation, so this sample are being inoculated on the because it is a virus, so you need the cell lines to grow these viruses. So they are being isolated in the primary monkey kidney cell line, and in the cell lines when they grow, so how you can detect that virus? That is by cytopathic effects. What are the cytopathic effects noted in poliovirus? That is the crenation, that the cells are crenated and or the cells get degenerated. Second modality, how will you diagnose this virus on the cell lines? By immunofluorescence. Third is by viral antigen or by the polymerase chain reaction. So these all things can be done once the virus grow on the cell lines. Then we can do antibody detection in the patient sample. So what sample will you take for antibody detection? That is the serum. So we need the serum sample whenever you are diagnosing for antibody in any of the infection. You need serum, and that is the pair serum. Pair serum means you are taking 2 serum samples, that is at the gap of 14 days. So 2 weeks later you have to take another sample. If both the samples are getting antibodies present there, and that is in the rising titer, so that is by neutralization test you can detect. Then third is the molecular techniques you can use directly for detecting the poliovirus. You can also know whether it is the wild poliovirus or it is vaccine derived. So these all are the different modalities which can be used. Mainly we go for the cell lines. Then there are referral centers are there where the samples are being sent, and there they will check for the whether the poliovirus is there or not. Then sewage testing. Sewage testing is not for any person diagnosis. This is mainly to know if this virus is circulating in our area or in our country. So this is being taken for testing this presence of virus, and this is mainly a surveillance program where you will, like we have said that for 3 years we have not get any wild strain poliovirus. So that means we are surveillating, we are taking these sample from different places, and we are checking for this wild strain, or if we detect any strain whether it is wild or this vaccine strain. So this is being used in the polio eradication program. So that is all for this, and the remaining, that is the immunization, which is very important for the polio virus, that I will cover in the next topic. Thank you very much.